Yes, good morning and welcome to Your Health Today with Dr. Soliman, another Saturday. We're going to be discussing something that is very interesting. We have discussed before. I don't know if it's possible, we'll start with the videos so we can see with this case. It's a reminder of other cases that we have discussed before, but it came my way last week, so I'd like to share it with you. We'll start with video number 1. All right, so they're not ready. So let's talk about GI system. Let's talk about the colon today. Okay, here it is. What happened to the audio?
And the surgery was performed on the 5th of February.
Yes.
And after that, I went for...
The surgery, they tell you the pregnancy was where? The ectopic was where?
They said it was on the right tube.
Right tube. Okay,
Yes,
so now upon scanning after a few months, we see a right ovary complex cyst, the one that I have measured it, and it measured 22.54 centimeters. So this is possible a complication there that has taken place. So we have a right ovarian mass, okay, right ovarian mass, and not only that, if I can show you also, there is fluids. This is the ovary, this is the right ovary, and here there is fluids that is around the ovaries as well, and that could be inflammatory fluids or God knows what kind of fluids, but anyway, this fluid shouldn't be there. And we can also see the uterus is being compromised. The walls of the uterus has been pushed upon. So it's like this mass is invaginating into the uterus, minimizing the uterus size small. This is the uterus here, that's the endometrium in the middle, and it looks absolutely fine, there's no problem. But this mass here is pushing against the uterus. So this mass here will have to be further investigated. Okay, that's it. A little bit cystic. Okay, we have multiple follicles there. So the left ovary is a little bit cystic. So cystic meaning so many spaces, as you can see. So this is the left ovary, and the left ovary is cystic. Now we need to evaluate the tube, but in the presence of such big ovaries like that, it's going to be a little bit difficult. But we can easily evaluate the tube. We have cystic left ovary. Okay, this is the external iliac. The blood is going through. This is my landmark, and this is my ovary, my left ovary right there. Left ovary looks okay, not as the right ovary. That's it. Okay, that's it.
Let me clarify this case. This is an ectopic pregnancy case. The lady came in, she had a surgery, ectopic pregnancy, a couple of months ago or so, and she came with a little bit of pain on that right side. So when we did the ultrasound, we found a mass. So there are a few questions here that we have to ask ourselves. Why did she have an ectopic pregnancy? We discussed that before many times, but I like to remind you. Why would somebody have ectopic pregnancy? Because the normal passage of the sperms, we have a very small sperm, microscopic, that has to go from the vagina, cervical canal, uterus, all those areas, they have contraction like, so they can help the sperm swim all the way to the fallopian tube, from the fallopian tube to the fimbria, where the egg is released from the ovary and fertilization take place. Once fertilization take place, now we have a sperm that is very microscopic and small, fertilizing an egg that's a bit bigger. Now we have a bigger size from a smaller sperm, very small sperm, fertilizing the egg. Now the size is bigger. So that means I need a wider diameter for those two things, the sperm fertilizing the egg. Now the division starts to happen, and that egg starts to get even bigger in size, because now we have formation, we have multiplication of the cells to form the zygote. So from a very small microscopic sperm that swam all the way from the vagina all the way up to the ovaries, now we have a bigger mass, that's the zygote. So now this bigger mass has to make the trip back from the fimbria, from the ovaries, all the way to the uterus. through the fallopian tube. So if the tube is not big enough, wide enough, the diameter is not big enough, this structure there, this zygote, will get stuck. And once it gets stuck, it will start implantation. It will start growing. And that is, now we have a growing baby in the wrong place. And that's why we call ectopic. Ectopic meaning out of the normal place, which is the uterus. So now we have ectopic pregnancy in the tube because that diameter of the tube was not large enough to allow the passage of that zygote all the way to the uterus. And this is the mechanism of ectopic pregnancy. Most common place is the tube. So now the pregnancy starts to develop in the tube. The tube gets bigger, 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 to a point where it cannot get bigger anymore. So boom, it ruptures. Once it ruptures, now we have emergency, because when it ruptures, blood vessels get broken and bleeding starts to happen, and you start to accumulate this blood in the pelvis, pain starts, and then the patient rushed to the hospital. Lucky if there is a surgeon on duty, then the operation is performed, and the ectopic pregnancy is removed along with the fallopian tube, most cases, along with the fallopian tube. So here it is, you have lost already one fallopian tube. Does that mean I cannot get pregnant? Yes, you can get pregnant, relying on the other tube, because normally you ovulate 1 month from one ovary, the next month you ovulate from the other ovary. So yeah, the pregnancy will be every 2 months, because we have lost one tube already. Most common cause of ectopic pregnancy, we discussed earlier in other sessions, we said is chlamydia. What is chlamydia? It's a microbe that get transmitted from male to female, females to male, through sex, and sex only. No towelettes, no towels that are used, none of those stories exist when we're transmitting chlamydia from one person to another. Chlamydia is in the vaginal fluids or in the semen of a man. And once you have intercourse, you exchange fluids, here is chlamydia, okay? Chlamydia is an intracellular organism. That means we cannot see it in gram stain. So if we take vaginal smear, don't tell me I did vaginal smear and they found chlamydia. It doesn't work like that. We have to do serology, or we have to do IgA or IgM or IgG. So this is maybe, so chlamydia exists, it's common, it causes infertility. Because of what mechanism? Because of mechanism that is called internal adhesion to the tube. It causes adhesion, meaning is like a spider web inside those fallopian tubes, whereby it blocked them, and there is no treatment. Even surgery we cannot do. We can only do surgery if the adhesion are external, due to external blood that has been clotted outside. But chlamydia causing internal adhesion inside the tubes, there is no treatment. So infertility is imminent in this case. So what is the recommendation? Make sure before you have sex your partner is clean. Meaning do a small chlamydia test before you decide to have a relationship. And if you do have a relationship, limit the relationship to one-on-one or multiple, but they all have to be in the same circle, and they all have to be checked, and they all have to be clean. So with sexually transmitted disease, this is how we prevent sexually transmitted diseases, no matter what. Even hepatitis B is a sexually transmitted disease, right? And there is a lot of hepatitis B. We have spoken about that before in the previous session. We're going to now change topics, and we're going to go to the colon. We're going to discuss the colon. A lot of problems with the colon, and a lot of patients complain about the colon, especially those who are a bit older. What is the most common organ or part in the GI that patients complain about? The colon. What is the colon? It's the large intestine. Large intestine move. They have motility. So that's why we can move the feces. But now you have to be very careful. This motility differs from one patient to another. If we lose the motility, especially in a small baby, that's a totally different disease. We have a rectum that has no ganglion cells that cannot move. So movement rely on neuron cells, rely on nerve cells that's inside the colon. Once we get older, this movement, these neurons get exhausted. So the motility inside the colon becomes less. And when the motility inside that colon that move the feces towards the rectum so you can stool becomes less, you most likely defecate in more frequent times, meaning constipation. So all people usually we see with constipation. Why? Because the motility of that colon has already decreased secondary to aging. Maybe there is other pathological factors that we'll explore. But you have a patient. I had a patient a couple of weeks ago that came to the clinic with left lower abdominal pain. Meaning what? In the left side of the abdomen, but lower abdomen, we have pain. The patient had pain always in the left side lower abdomen, always in the same spot. Years after years, the pain is still there. Nobody knows what's going on. Well, I'm going to tell you. The most common cause for a pain in the left lower quadrant or the left lower abdomen is something called diverticulosis. The name might be difficult, but I'll make it simple for you. We have normally the colon wall. It's a wall that has different layers. Sometimes we have bouching, we have ballooning of this wall. The wall at some point becomes weak. When the wall becomes weak, it bouches out. It makes a bouch. So we have the wall going straight, and then at some weak point, it bouches out, and it makes like something like a sac within the wall. So now it's a weak wall that form a bouch. And now what's in the colon? The material in the colon is the feces. So now we have accumulation of feces in that bouch. According to the size of the bouch, according to the size of this balloon, we will have complication. Any balloon, eventually it will get bigger and bigger and bigger. And what is the outcome once a balloon gets too big? It bursts, it ruptures. That is the same thing with diverticulosis. When we have diverticulum, meaning a balloon inside the colon, and especially the most common place will be the left side, left abdominal pain. Those patients, especially a bit older patient, they always complain of the left lower abdominal pain. That is diverticulosis, diverticulitis. We're going to explain the difference between the two. But again, let me not get you confused. We have bouching of that wall of the colon. That bouch can accumulate, feces can accumulate inside. Since the wall is very thick, we have a chance that we rupture some of the vessels. So the patients will see blood in the stools. So we have now left side pain, left lower abdominal pain, and we have a small blood in the stools. That can only be one thing, which is diverticulosis. Blood in the stools with left lower abdominal pain. Most likely it is diverticulosis. So we do not go any further. Now, if the feces accumulate and feces have bacteria, and now we have a wound, so that means we are prone to infection at that site. So that means we have now a case called diverticulitis, meaning we have the balloon that has been injuring a blood vessel. We have accumulation of feces with bacteria. Now we have an infection. How would the patient come? The patient will show fever. So you will have a little bit of fever, a little bit of blood in the stools, and pain in the left lower quadrant. Very much similar to appendicitis, but appendicitis happen where? On the right side. This happen where? In the left side. So if you have left lower quadrant pain, you see a little bit of blood in the stools, and you run a little bit of fever, we know we have a condition called diverticulosis complicated with diverticulitis. Forget about the names. We have a bouch, we have a balloon in the colon that has a bit of complication. Well, number one, bleeding. Number two, possible infection. So now the patient will run exactly the same scenario like appendicitis, So what is the situation here? Well, you cannot go to somebody and tell them, do me an endoscopy, a colonoscopy, whereby I put a colonoscopy there. And the colonoscopy, what we do with the colonoscopy, we put air, we inflate air. So if we have a balloon inside the colon, and then we add air to the colon, what's going to happen to the balloon? It's going to rupture. So that is a problem. So you cannot be doing colonoscopy for a patient suspected with diverticulosis diverticulitis, because you're going to rupture the balloon, and then we have perforation, and that's a big problem now. So you came with a small problem, we send you home with a much bigger problem. So we do not do colonoscopy for such patient. So what is the recommendation? If we have this case, then we do CT scan, much safer, and we will see the diverticulum or diverticulosis or diverticulitis. We can easily see it with a CT scan. If the patient has the fever and complicated to diverticulitis, then we add a little bit of antibiotics, and the patient goes home and the situation will be resolved. So careful diagnosis and careful approach to a patient with diverticulum, diverticulosis, diverticulitis is essential for the safety of the patient. Number one, we cannot do colonoscopy if the patient proven to have diverticulitis, because the wall is already thin and we can rupture. Best thing to do, CT scan. And after the CT scan we see is safe, we can do a colonoscopy to determine the, if we want to do something about it. But normally it resolve with a little bit of care. Let me take 1 minute break and then we'll come right back.
Are you facing challenges in your health? Then Dr. Soliman Clinic and Labs is here to provide you with the lasting solutions to your health problems. Dr. Soliman Clinic and Labs is specialized and offers consulting in psychiatry, internal medicine, cardiology, urology, dermatology, gynecology, infectious diseases, and infertility. At Dr. Soliman Clinic and Labs, we offer 3D/4D scan at just 5,000 francs, emergency ambulance, free ultrasound scan, and free medical consultations. Our staff is composed of well-trained doctors with good laboratory and best equipment. We are located in 2 cities, Boya at mile 18 Bulifamba, and in Douala, we are located at Entrepilor. You can reach us through the telephone number 694-940-172. Your health is at the right place with Dr. Soliman.
Okay, wonderful. Before we move to another patient, I want to tell you another complication that you may look out for. If you see air bubbles in the urine, when you urinate, you see air bubbles, or you see fecal matters, feces inside the urine, that's a very alarming sign here. So if you have the history starts with pain in the left lower abdomen, always there, pain in the left lower abdomen. Then, you see blood in the stools. Then you may develop fever and you be a little bit sick. Then you see air in the urine or fecal matters in the urine. That's the very alarming sign here. What happened here? What happened is that small pouch, that small balloon there, got growing a bit more, till it touches the urinary bladder where you urinate. When you urinate, you have a reservoir there called urinary bladder. So some of pieces of this pouch there at the colon touches the urinary bladder, and when it touches the urinary bladder, it forms a communication. So now we have a hole between the colon and the urinary bladder. That is we call fistula, but don't worry about the term. So we have a hole that is communicating the colon with the urinary bladder. So obviously the colon has air, so you will see air in the urine, and obviously the colon has feces, so you will see feces in the urine. Once we see that, that's a surgical correction right there, because we already have communication between the colon and the urinary bladder. So this is in summary, what you will feel or what will happen. What is the possibility if you feel left lower abdominal pain, and the complication we said is pouching, can develop into, start with small bleeding in the feces, then develop to fever and a bit more pain, then it can even complicate to seeing air or feces inside the urine. So at the first sign of left lower abdominal pain, you should not ignore it. You should seek help and see a professional doctor to evaluate and correct the problem before it gets much worse. Okay, so now for all the clinicians out there, anybody with left lower quadrant pain, we do not do colonoscopy, because of the fear that you may rupture the pouch if there is one existing there. You cannot do that. You have to start with a CT scan, get a roadmap, and then if you want to do colonoscopy later, you can do that later. Let's move to another topic. So we discussed the patient with left lower abdominal pain. Let's move to another topic. Let's now talk about something called ischemic colitis. Ischemic colitis. What is ischemic colitis? Remember when we talked about angina, the heart gets ischemia, the intestine also gets ischemia. How can intestine get ischemia? By the same mechanism. It's the same body, the same thing. So when we have a narrow blood vessel, every organ in your body gets supplied by blood. And this blood carried by a blood vessel. If this blood vessel get narrowed by means of atherosclerosis, any substance that is most likely going to be atherosclerosis, but to make things a bit easier for you, this blood vessel here has this much diameter, like this. If I have precipitant here, a fat or solid material here, whereby I decrease the diameter of this vessel to almost half or less, I diminish the blood flow to that organ. So that means if I was getting X, now I'm getting X minus 50 or whatever. I mean, I'm getting half X of blood flow to that organ. So that means this is what we call ischemia. And when we have ischemia, then things are not getting fed the way they're supposed to fed. And when you don't get fed the way you're supposed to get fed, you die off. Okay? First, you are dizzy, you're suffering, you are pale, you are weak, you are fatigued. That's the same thing. The intestine get weak, get fatigued, get fragile, and anything, the next step will be dead. After all this suffering, we call ischemia, then some of this part will die, and now we may have a lot of bleeding, because now we minimize the blood flow to that intestine, and that is a very bad scenario. That is a very bad scenario. So what is your role here, and how will this present? Well, we get clogged up. Our vessels get clogged up because of something called lipids or fat in the blood. So it is your duty after a certain age, especially, or when you feel abdominal pain that is not going away. And a lot of those people die because they get misdiagnosed. A lot of those people die because they get misdiagnosed. The patient will usually come, and I had few of them. The patient will usually come bloody diarrhea and weight loss like skin over bones, skeleton, because there is colitis all over the place. The intestine is not absorbing any food, but the intestine is all gone. If the intestine does not get enough blood supply to survive, it will die off. It will be ischemic. It will be very pale. It will be very weak. And that's what we call ischemic colitis. It's a very bad condition. So we have to recognize what is the problem. The problem is narrow diameter of the blood vessel that feeds the intestine. We have to correct the problem. Now, better yet, why would I wait till I get clogged up? Why don't I just wait? Why don't I just do a small test called cholesterol or lipids in the blood to find out if my lipids are high or not? And that will prevent a lot of problems. So if you are a little bit over 40 or so, you are at risk. Everybody is at risk, right? But especially at older age, especially 40, 50 and above, do cholesterol. Make sure everything is okay. So when you get a little bit of abdominal pain that persists, when you get bloody diarrhea that persists, don't take things lightly. You're actually too late now. But to prevent, why don't you do lipids in your blood and find out if your lipids are high or not? And it's a very small tablet to take care of it, and problem is solved. You will not even get into the problem. You're preventing the problem by doing the screening and see if your lipids are within normal range or not. If happen that you do not check and you get to the condition that there is a bit of abdominal pain, And a little bit of bloody diarrhea actually is not going to be a little bit, it's going to be continuous, will not stop, because ischemia cannot be treated by a tablet. Ischemia, when we have ischemia meaning minimized blood flow to the intestine, cannot be treated by a tablet. Now we're talking about a big thing right now. We're talking about a big thing. We're talking about ischemia to the intestine that can be followed by an infarct, and that's a serious condition. Let me take another 1 minute break, and then we'll continue, inshallah. 1 more minute break.
Are you facing challenges in your health? Then Dr. Soliman Clinic and Labs is here to provide you with the lasting solutions to your health problems. Dr. Soliman Clinic and Labs is specialized and offers consulting in psychiatry, internal medicine, cardiology, urology, dermatology, gynecology, infectious diseases, and infertility. At Dr. Soliman Clinic and Labs, we offer 3D/4D scan at just 5,000 francs, emergency ambulance, free ultrasound scan, and free medical consultations. Our staff is composed of well-trained doctors with good laboratory and best equipment. We are located in 2 cities, Boya at mile 18 Bolifamba, and in Douala, we are located at Entrepilor. You can reach us through the telephone number 694-940-172. Your health is at the right place with Dr. Soliman.
Yeah. So to recap, to summarize again one more time. So what will this patient with ischemia, with limited blood supply to the intestine will complain to you? They will always come, Doc, every time I eat, I get pain. Every time I eat, I have abdominal pain. Every time I eat, I have abdominal pain. You check their stools, there is blood in the stools. And sometimes in worst case scenario, when the case gets worse, they have bloody diarrhea. So what do you expect the weight of these patients would be? Those patients will be very skinny. Like I told you before, will be like a skeleton because they are afraid to eat. And the pain is very serious. So why is that? Because exactly like the heart condition, when you run and you have ischemic heart disease, what happens? You get tired. So what is the exercise for the intestine? When you give it food. Because when you give it food, you're going to force it to move and to digest and to absorb. So this is exertion for the intestine. Meanwhile, the intestine does not have what it takes to continue movement, absorption, digestion, all the functions of the intestine that is supposed to do. She cannot do if there is no food, if there is no energy supplied to it. And the energy and the food supplied by the blood vessels, by blood. And the blood has been diminished, has been minimized because the diameter of the delivering vessel has been cut in half or maybe more. So that's what we call ischemic colitis. And this is how the patient presents. And sometimes we need surgery to replace the vessel and to correct the vessel that is supplying the intestine, bypass it or do something about it, so whereby the patient can no longer feel the angina anymore, the ischemic colitis anymore. So this is a very serious condition, and I did have a couple of cases, 3 or 4 cases over the years here, presenting the same bloody diarrhea, weight loss. Every time he eats, he gets stomach pain. That's very clear-cut case. This is SMA. We need, the vessel that supplies the intestine has been compromised. We need a very good, vessel study, and we need to determine exactly at what level. And this is now vascular surgery. Vascular surgery when the case gets so bad and so dangerous. So now we can prevent all that by just doing a screening early before things get worse and our vessels get clogged up, right? Our vessels, the test is very cheap, it's not expensive, but we know, and there's a couple of tablets you take and things are back to normal and you wouldn't even get into the situation. So we spoke now about the patient with diverticulum. We spoke about the patient with the ischemic colitis and how they present. Now we're going to talk about a patient that has irritable bowel disease. This is something like mostly women have that. And how this disease, how the patient complain? The patient will complain about today diarrhea, tomorrow constipation, constipation, diarrhea, diarrhea, constipation, alternating. This and that, and distension of the abdomen. her abdomen big, feels like she's pregnant, but she is not. So bloating and alternating diarrhea with constipation, that's what we call IBS, or irritable bowel disease. Mostly is going to be women, and this is a condition that is, we say, is because maybe bad motility of the intestine. So it's disturbed motility. It has to do maybe with stress, it has to do with hormones. Nobody really knows why women have this condition. Men also have it. This is irritable bowel syndrome, and in this case, like I said, you'll have diarrhea alternating with constipation. You have a little bit of bloating, your abdomen is distended, and nobody knows. So what is the solution for this condition? The solution is very easy. You will just add fibers to your diet. You have to have fiber-rich diet. Fiber-rich diet meaning a lot of fruits, a lot of vegetables, a lot of things that contain fibers. Refined food is not a good idea. This condition is very much popular in the West, in the Americas, in those people will they eat only refined food, and food that is very sterile, no microbes in it because of the processing of the food there. Here in Africa, no, the condition is different. We rarely can have this condition because we don't really rely much on refined food. Even though now, as the years advance, we introduce more refined food into our diet, which is not a good thing. Natural fruits and vegetables and things that has not really been processed by food processing companies, adding chemicals and refining food, sterilizing everything. We need a little bit of microbes, normal flora, normal bacteria for our immune system to be strong. If we don't get exposed to microbes, we will have zero immune system. We are much stronger in Africa as far as immunity than anybody in America or the West. Why? Because we have been exposed in our diet, in our environment, to microbe. And the only way to get immune is by exposure. So if you have never been exposed, you can never develop an immune system that is good enough to defend you. When you're immune, living in Africa, you can live anywhere else in the world because you're already immune to a lot of things. That's talking about adults, talking about the children, the same way. So the environment we live in gives us immunity. And we thank God we live in Africa, we're very immune. So now, let's now talk about something else. So we'll talk about irritable bowel syndrome. What is the treatment? The treatment is very easy. Something called, I don't want to say a medication name, but there are a small medication you take and it will make things easy for you. So the first thing that you want to do when you have irritable bowel syndrome, and you out there listening to me, you know that you have it. A lot of you have it. A lot of you come to me complaining about the same thing. It's irritable bowel syndrome. Nothing serious. just change your diet, add more fibers to your diet, and a couple of more tablets you will take every now and then, situation resolved. Okay? So let's take a 1 more minute break and then we'll move to a different topic.
Facing challenges in your health, then Dr. Soliman Clinic and Labs is here to provide you with the lasting solutions to your health problems. Dr. Soliman Clinic and Labs is specialized and offers consulting in psychiatry, internal medicine, cardiology, urology, dermatology, gynecology, infectious diseases, and infertility. At Dr. Soliman Clinic and Labs, we offer 3D/4D scan at just 5,000 francs, emergency ambulance, free ultrasound scan, and free medical consultations. Our staff is composed of well-trained doctors with good laboratory and best equipment. We are located in 2 cities, Boya at mile 18 Bolifamba, and in Douala, we are located at Entrée Pilote. You can reach us through the telephone number 694-940-172. Your health is at the right place with Dr. Soliman.
All right, I would like to start this topic with those 2 images. The two before last. The one with yes, this one, we're going to stop here. So this here is when we do a colonoscopy. When we do a colonoscopy, we see this is like a hole. Is like a hole inside. It's like a hole inside the wall of the colon. Okay, and this is what we talked about earlier. This is the diverticulum. Remember when I said balloon? It's exactly like a balloon. So now here we're looking with a camera inside the colon, and then we see this hole there. So that's a diverticulum. This is what a diverticulum look like. So this is now a weak point of the wall that has bulged out. And now this hole will collect feces inside. And once it collects feces inside and it gets more blown off, more bigger, now at some point some vessels will be broken, blood vessels, and now we see blood in the stools, and now we see infection and lower abdominal pain. This is what we call diverticulosis diverticulitis, or even can form a fistula. So this is what it looks like when we do a colonoscopy. Let's move to the next image, and then we're going to talk about this other case. Yeah, now this is here. You know, we're going to talk, leave this here, and let my voice will be enough. This is, we talk about polyps. This is a patient here, when we did colonoscopy, meaning we go with a microscopic, we go with small camera inside, we see a lot of polyps. This is what polyps look like. You know, polyps, some of it has a neck. They are different structures. So this one here has a neck, this pedunculated polyps, a lot of them, is like a carpet full of polyps. And this patient here, most likely the reason will be genetic. That means his father has it, his grandfather has it. Now what is a polyp? A polyp is something that we can see 1 or 2, we can see 3 or 4, we can see 10, we can see 1,000,000 of them like this one. So in this case here, if it's only few, then it's surgery, we have to remove it. Even though they are benign, meaning they are not initially, when they start benign. Benign meaning they are not cancerous. Benign mean they are not cancerous. But with time, they develop into cancer. So this is what polyp look like. Whether they have a neck or they are sessile without a neck, the recommendation is we have to remove them. Because they can, with time, they can move into becoming cancers. Okay. Now we have a small. It's enough. We have a small medication that we can give. Everybody knows aspirin, right? Everybody knows aspirin. We take it for the heart condition. When we have ischemic heart disease, we took aspirin to make the blood a bit more thinner so it can flow better, right? This is the idea. The aspirin makes the blood a bit thinner, okay, so it can flow better and it can prevent any clots from forming. So we don't have any problems with the heart or with the vessels in the brain, so we don't get a stroke, right? This is the function of aspirin when we give it to heart disease patient. But also aspirin, we find out that it's good also for patients with polyps because it delays the progression from benign polyp into something that is cancerous. Why I'm saying that? We have a patient 75 years old. He is not candidate for surgery, yet he has polyps. So what are you going to do with this patient? He is not eligible to go for surgery. So this patient we give aspirin to, right? So we can delay the progression of this polyps into becoming a cancerous polyp, right? So this is what we do. So polyps, it's a condition like we have seen, and it's not, is not very serious when you first discover it, when they are small, and you can see with colonoscopy, we see that, but with time they will develop. It takes a few years, and they will develop into cancer. So the recommendation is remove them, and if the patient is not candidate for surgery, then we give aspirin. We give aspirin to both patients anyway to delay the progression into cancer. Okay, so that's a good thing. Now let's talk about one last topic, which is diarrhea. Who doesn't have diarrhea? Everybody out there at some point of your life had diarrhea a few times, right? So the thing I want to tell you today, anytime you take antibiotics, you are at risk for diarrhea. So what does that mean? Antibiotics causes diarrhea. Yes, especially a drug called clindamycin can cause you to have diarrhea, absolutely, without a doubt. So that is, we call antibiotics-induced diarrhea. So now, is this the only way I can get diarrhea? Obviously not. But if you take antibiotics, you take a course of antibiotics, and later on you develop diarrhea, do not panic, because this is antibiotics-induced. So the piece of information that you should know, anytime I take antibiotics, I might get diarrhea. So what is the solution? Well, the solution is another antibiotics, believe it or not. So antibiotics cause diarrhea, and the solution is taking another antibiotics to stop the diarrhea. So So this is one thing that I like to share with you. And then the second thing is, what other things can cause me diarrhea? Diarrhea is a very, common thing. It's not very common. I mean, a lot of people have diarrhea. Children have diarrhea, adults have diarrhea, old people have diarrhea. And diarrhea means a lot for me, especially when there is other symptoms. So I cannot just look at diarrhea alone. I have to evaluate diarrhea with other symptoms. I have to look at the diarrhea. Does it have blood? It doesn't have blood. It has pus. It doesn't have pus. Is it watery? Is not watery? All those are different reasons for somebody to have diarrhea. But nevertheless, when you have diarrhea, you lose in body fluids, right? When you have diarrhea meaning what? Meaning you lose in a lot of stools accompanied by fluids. So when you have diarrhea, the first thing that comes to your mind is, I'm being dehydrated. I'm losing a lot of fluids. So what is the solution here? The solution is to replenish the fluids. That is number one. Now, if you are having diarrhea because of antibiotics and you need the antibiotics, you must continue the antibiotics. You cannot stop the antibiotics. But in addition to those antibiotics, we add another antibiotics to stop the diarrhea. The way when I treat patients, I add this antibiotic anyway, so the patient doesn't have to come and, doctor, I have diarrhea. No, I already gave it to them from the very beginning. So we save, I save the patient worry about having a diarrhea, and I save myself the headache from a phone call, doctor, I have diarrhea. So we take care of it from the very beginning, and then we are safe. Now, the last topic I wanted to talk about is colon detoxification. How to detox the colon. The colon is like the waste bag, is like the trash bag for the body. Everything is there. All the toxins are there. So that colon really is a collection of all the toxins in your body. And if you have bad mouth odor, if you have pimples in your skin, if you have acne, the source is the colon. The source is the colon. This is the collection of all toxins in your body, is the colon. So what can we do if I want a clean skin? If I want more energy? If I don't want to feel bloated all the time? If I want to feel energetic? If I don't want the acne on my skin? If I don't want my breath to smell bad? I detox the colon. Detoxification of the colon will work for you beautifully. It happened that we have one product. Please, if you can play the last image, Mr. Johnson, I'll appreciate it. Yes, this product here, it's mainly composed of something called Senamecca. Senamecca is a natural product, no side effects. It's like a tea. You drink it like a tea, among other things. But mainly, we rely mainly on this one. And this one will clear your colon in a matter of 4 hours to as far as 8 hours. So what will happen? You will have cleaning and you have diarrhea. That's induced diarrhea, and you will flush out very much everything in the colon. I recommend that patients should take it, or normal people, not only patients, take it once a week at least, like on a Sunday, because you will go to the bathroom a few times to evacuate everything inside your colon. So I'd recommend to do it in your day off, whereby you have a close by toilet, because it will really clean you up and you will feel much relaxed. Those with IBS as well, with irritable bowel disease, that feel bloated and distended all the times, this is also a very good thing. A very good thing for them, because once they evacuate the colon, they will feel much better. That is actually the treatment. Once you evacuate the colon, you will feel much better. Once you continue in this product on a weekly basis, if you have acne vulgaris, for example, acne vulgaris is a condition that is caused by a bacteria in the skin, right? So yes, we will evacuate, we will clear, we will give a chance for the medication for the acne to work better. You will have more glorious, more glowing skin. You will have better health. Everything will be absolutely fine. We'll see you next Saturday. Continue to enjoy the weekend, and God bless you all. Thank you.